Good day everyone, my name is John Paul Castro, and today, in this discussion, it tackles about masturbation, the definition, information, and benefits of masturbation. So first, what is masturbation? Masturbation is the self-stimulation of the genitals to achieve sexual arousal and pleasure, usually to the point of our orgasm or sexual climax. It is commonly done by touching, stroking, or massaging the penis or clitoris until an orgasm is achieved. Masturbation can involve a person exploring their own body, but can also happen between two people. That what's called mutual masturbation. And when an individual stimulates their genital for sexual pleasure, which may lead to orgasm or sexual climax, this is temporary and it occurs in a short period of time. Masturbation done by males and females. Both males and females can possibly experience this because they are capable for self-stimulation and exploration of their own body. More common in the younger age or youth because some of the reason is they become curious about something and they explore their body and try everything like masturbation. Masturbation causes your body to release a number of hormones. These hormones include the first one, dopamine. This is one of the happiness hormones that's related to the brain reward system. The second one is endorphins, the body natural pain reliever. Endorphins also have their stressing and mood boosting effects. The third one is what we call oxytocin. One of the main reasons orgasm feels so good is because your brain releases the pleasure hormone oxytocin when you're in climax. Oxytocin, also called the love hormones, because of its important role in facilitating social bonding between humans. The next is testosterone. This hormone is released during sex to improve stamina and arousal. It's also released when you have sexual fantasies, according to 2011 study trusted. The next is prolactin. A hormone that plays an important role in lactation. Prolactin also influences your mood and immune system. Masturbating can cause you to release healthy amounts of the above hormones, which is why it can possibly affect your mood and physical health. Sometimes, masturbating can help you feel a little better when your mood is low. So let's proceed to the benefits of masturbating. Number 1. Pleasure and convenience. Upon being challenged for masturbating in the marketplace, the ancient philosopher Diogenes the Cynic replied, "If only it were so easy to soothe hunger by rubbing an empty belly." According to Diogenes, the god Hermes, taking pity on his son Pan, gave him the gift of masturbation, which Pan then taught to the shepherds. To masturbate, there is no need for special equipment, the intricacies of sexual intercourse, or even a partner. Although it is often looked upon as the poor relative of sexual intercourse, many couples engage in mutual masturbation, either alongside or instead of intercourse, to simplify, improve, or enrich their sexual lives and arrive at orgasm. The number 2 is fewer complications. Masturbation is safe as well as inconvenient. Unlike sexual intercourse, it is very unlikely to lead to pregnancy or sexually transmitted diseases such as human papillomavirus, chlamydia, gonorrhea, syphilis, herpes, and HIV/AIDS. Not to mention other communicable diseases such as flu or coronavirus. The third is stronger, more intimate relationships. Contrary to the popular perception, there is, at least in women, a positive correlation between frequency of masturbation and frequency of intercourse. People who masturbate more are more likely sexually driven, and mutual masturbation is likely to increase the frequency and variety of sexual contact, both in the performance and in the observation. Masturbation can teach partners about each other's pleasure centers, proclivities, and particularities. If one partner is more sexually driven than the other, as is often the case, masturbation can provide him or her with a balancing outlet. The fourth benefit is better reproductive health. In men, masturbation flushes out old sperm with low motility and reduces the risk of prostate cancer. If practiced before sexual intercourse, it can delay orgasm in men suffering from premature ejaculation. In women, it increases the chances of conception by altering the conditions in the vagina, cervix, and uterus. In both women and men, it strengthens the muscles in the pelvic floor and genital area and contributes to extending the years of sexual activity. Next is faster sleep. Masturbation invites sleep by reducing stress and releasing feel-good hormones such as dopamine, endorphins, oxytocin, and prolactin. Orgasm in particular brings on a state of stillness, serenity, and sleepiness, sometimes called the little death. In French, it's what we call la petite mort, which can usher in a deeper sleep. It can help alleviate stress and anxiety. The next is, it improves cardiovascular fitness. Masturbation is in effect a form of light exercise compared to regular exercise. It is more effective or efficient at reducing tension and releasing feel-good hormones. The muscle and blood vessel relax, improving blood flow and lowering heart rate and blood pressure. The other benefits is brighter mood and other psychological benefits. Masturbation reduces stress and releases feel-good hormones, which lift mood and reduce the perception of pain. It promotes better, more restorative sleep. Lacking sleep's myriad physical and psychological benefits. It offers an escape from the constraints and demands of reality, an outlet for the imagination in fantasy, and a medium for the memory in nostalgia. But the effects are not always positive. While there are proven benefits, some people do have negative experiences with masturbation. It's important to remember that it's totally okay not to masturbate. You might dislike the feeling or it might be against your belief system. Is masturbation totally normal? Science say yes. Masturbation is healthy and safe. But in some religion, masturbation is a kind of sin and immoral. Some religious people experience negative feelings related to social or spiritual expectations. Masturbation is considered a sin in some religions. There are also many societal stigmas attached to masturbation. So let's proceed about the myths about masturbation. Even though masturbation is a common part of sexuality, some people feel ashamed or embarrassed about masturbation, partly because of outdated myths. Masturbation has been incorrectly blamed for a range of health problems, including the following: infertility, blindness, mental health issues, sexual perversion, and reduced sexual function. That's not to mention the anxiety-inducing myths around masturbation. Many of us have heard the rumors that masturbation causes you to go blind, or that it can cause you to grow hair on your hands, but completely false claims that seem to circulate widely among preteens. If you believe those things and go on to the masturbate, you might experience feelings of guilt, anxiety, shame, or self-loathing afterwards. It's totally okay to abstain from masturbation because of your personal beliefs. And that's all. Thank you.